Sorry for the past few days I've not been around. If you remember, I told you I was going for um do I say one thing? I went for the believers convention. I am stretched physically, but I am energized spiritually. May God answer all our prayers and may God never allow us to walk alone. So, what have you been up to? How are you doing? Hope you are fine. Just came back yesterday and I slept all through yesterday. Though I'm still feeling because I have cold, you can hear it from my voice, but the joy of the Lord is my strength. It's been a while and I don't like leaving my channel for long because it's not good for the growth. So I have to just come here for some few minutes to have some chit chats with you that will benefit you as a pregnant mom. The husband also can learn one or two things from it, or maybe your sister, your friend, your neighbor is pregnant. It can do there some good. So today I'll be talking about backache in pregnancy. Backache in pregnancy. Most pregnant women, if not all, experiences this backache during pregnancy. Some even with leg ache, because number one, when you are pregnant, you had more weight, and even your body will feel so heavy. So for you to tackle it, you have to learn one or two things about backache in pregnancy. And backache is one of the most common discomforts during pregnancy, especially in the second and third trimester. You will know when the pregnancy is in the first trimester, that's the first month to the third month. Most people will not even know that you are pregnant. The uterus is just getting big and is rising up from the pelvic region into the abdominal cavity. So you may not have any backache. But from second and third trimester, the second trimester, the pregnancy would have been like 6 months. Then from third trimester, 7 months to the 9 months. So the weight of the uterus will be overwhelming and the clients may be having back ache. And this happens because the growing uterus shifts a woman's center of gravity. Yes, the uterus shifts the woman's center of gravity. Then there are some hormones that will loosen ligaments and extra weight. And this puts strains on the back of the pregnant woman. All these things that I talked about, that the growing uterus, changes the center of gravity of the woman, hormones losing ligaments, and extra weight put strains on the back of the pregnant woman. So all these things can make a pregnant woman to be having backache from mild to something very terrible. So what are the causes of this backache? I can say we have weight gain, just like I told you before. Then posture changes. Some women, when they are pregnant, even the way they sit, even if you are not pregnant, you have to maintain good posture in sitting down. Then when a woman is pregnant, because the uterus is growing, you see that even her balance, her posture changes, and this can put strains on the back. Then hormonal changes, relaxing, loosens joints. So hormonal changes in the body can cause so many things, just like a menopausal woman, because the estrogen level has really dropped now, and all the hormones that she uses for her menstrual phase is now dropping. So there will be so many changes. I remember when I just started experiencing this, I entered menopause 2 years ago, and one thing I discovered was that I sweat a lot. If I go out, who bought me that time to do makeup? If I was going out, I won't do makeup, because before I even get to my car, or before I even trek to somewhere, my face will be soaked in sweat. My mind didn't go there in time. It was later, and I remember that, oh, this was menopause. So many things in women's body that hormone control most of our body system, and this can have effect also due to pregnancy. Muscle separation in the abdomen. Yes, because the muscle now, they are stretching, they are enlarging to accommodate the growing uterus. So this can also cause backache during pregnancy. Welcome, Adamu Shuaibu Karageya Keke. Kanala here. I can speak Hausa. Where are you from? I lived in Kebbi State before for over 30 years before I relocated back to Lagos, Nigeria. Yeah, Gidaya Aiki. Thank you for coming. So, stress and fatigue can also cause backache during pregnancy. So you have to, if a woman wants to, I think I saw a video that if you want to sweep, the way you bend to take something, you have to stoop a bit and, you know, take that thing. You don't have to overstretch yourself. And when you are tired, please find time to rest so that this backache will not get worsened. So what are the tips for relief for a woman that is going through backache during pregnancy? You have to always maintain good posture. Either you are sitting down on a chair, either you are standing, either you want to pick something, you have to make sure that you always maintain good posture. This will help you and prevent you from having backache. Even if you will have it, just be a mild one that even without taking any medication, you feel all right. Use supportive chairs and a firm mattress. Yes, not sleeping on a good mattress can also cause backache, not only to pregnant women, even you that are not pregnant. If your mattress is too soft or it's not well balanced, honestly, you wake up, you'll be feeling as if you were beaten in the night. So you need to get a very good mattress, and you have to know the kind of chair you use. You can get a chair. There's this chair our parents use that time, this armchair that my daddy would bring out in the evening for him to relax. Something that will maintain your posture, that will align your back well, so that you will not be having this backache. Then wear low heel comfortable shoes. Yes, I'm not pregnant, but now I'm 56. I'm not getting younger. Recently, when I was in the UK, I came back from the UK in June. From there, I started having this right knee pain. And I love wearing, though I'm not used to wearing pencil, but I wear block heels, no matter how high it is. I love wearing it because, you know, high heels add elegance to your dressing. But this leg ache, oh my God, it was so painful that, in fact, I'm just feeling the relief now. When somebody told me that I should be putting ice block, so when I started using this ice block, I now feel it because I've taken drugs. I was even thinking of going to Igbobi orthopedic hospital to go and see a doctor. But most women, when you discuss with them, they will say, everybody has the problem. I said, is this how I will not be working? I can't even wear any good shoe. Now I wear only low shoe. So you that you are pregnant, you don't have to, no matter how you love fashion and you are having slight backache, no matter how little it is, please wear low heel. There are some very beautiful low heels that you can wear. You can get some black that can go with anything. I have low heel because honestly, me as a woman, that's why the fact that I'm getting older, I don't like wearing slippers like that. If I wear slippers, I will just be feeling as if my dressing is not okay or it's not complete. So I love wearing shoe. I love wearing shoe or sandals. So you can get low heel comfortable shoe, something that is comfortable to you. One thing I don't do also is that I don't follow trend. I wear what is comfortable for me because our body are different and you don't know what I'm battling. People that see me dance, they will not know that I was having that leg ache. It was so serious at times. I've just been thinking that, what is it? What is happening to me? I've taken, as a nurse, I know what to take. I've taken drugs, I've used a balm, I've used different things to rub it. I have gone for massage. Still, this pain, sometimes if I'm walking, it will be as if my joint wants to remove. I say, God, I know that it's arthritis and it's common in women also. So always wear comfortable shoes. Then sleep on your side with a pillow between your feet. Thank God, pregnant women of these days, they are enjoying. You know, I saw Rewari Pikin advertise one pregnancy pillow that you can use to sleep. During our own, who that shows that one? When she put it like this, she slept so comfortably. So please, you can tell your husband to get one for you so that you will sleep comfortably. Gentle exercises like walking, stretching, and practical prenatal yoga. You can take a walk in the evening and then stretches. You can stretch. You can get a mat to lie down in your room or in your sitting room. Just stretch. Do like this. You know, that will also help you, you know, for you to get relief from your back ache. Thank you for the like. God bless you. Then warm compress or prenatal massage. Yes, you can get not water that will burn your body. Warm water use your towel and tell your husband to massage it gently, or you can go for prenatal massage. Honestly, massage is very good. At least in my life now, I've gone for massage maybe like 5 times, and there was never a time I went for massage that I never enjoyed it. I love it. So for 2 days, I will be sleeping like a baby. The last one I had, it's not even up to 3 weeks now that I had it, and I love it so much. It relieves me tension everywhere because I'm a businesswoman. I go to the market every day. You can imagine in this Lagos going to Balogun from Bagada, though it's not too far, every day from Monday to Friday, because I'm a personal shopper too, and I have to be going to the market. All this, my legs will be paining me. But when I went for that massage, I love it so much, and it really brought me so much relief to all my body aches and my painful joints. So please, these are all the things you can do as a pregnant woman that is experiencing backache. And just like I always say, and I will always say it either in my video, either in my life, that as a pregnant woman, you know this thing that you are experiencing now. Maybe you are a new mom. You have never been pregnant before. And even if you are pregnant before, you've been pregnant before, pregnancy differs. My mom will say if you are carrying a boy, it's different. If you are carrying a girl, it's different. But it's you that you are pregnant that knows what you are feeling. It's you that knows what is going on in your body. So you need to make sure that if you are not feeling fine, please speak to your midwife, speak to your doctor. Don't keep quiet. Speak out, speak up. Tell your mom, tell people. And moreover, the best thing is for you to go to hospital. Don't do self-medication. Please, I beg of you. You have a growing baby inside of you, and you don't have to take any risk. You have to be very careful of the kind of drugs you take. Then, see your doctor if symptoms persist or when pain becomes so severe. I've seen a pregnant woman with a backache that she was weeping. It was as if somebody was choking her pains on her back, or sudden or associated fever, vaginal bleeding, or burning sensation. You feel all these things that I mentioned. You feel the pain is so severe and it's so persistent. You feel sudden or associated fever. You are having vaginal bleeding or burning sensation. Please, any of this sign is a sign of complication. It may even be abortion, that's an oncoming abortion, that is causing that backache, because backache with lower abdominal pain with bleeding may mean threatening abortion, or maybe no, may mean premature labor, or maybe you want to rupture your membrane and the baby can come out before time. And if you're in an area that you don't have uh, maybe in the village you are, there's no neonatal ward where the baby can be put in incubator, you could lose that baby, and which we don't want it to happen to you. So please, you have to make sure that as soon as you are feeling these things, please go see your doctor before it becomes severe and you have a problem with that. And you see some people, they even get this pregnancy support belt. They will wear it. The one Priscilla was wearing, they said she was wearing bump. How will a 24 years old girl be doing surrogacy? For what? She's fertile and she's okay. Even if they said the husband cannot produce, different stories. It's not even my problem. What I'm just trying to say is that there is what we call pregnancy support births. It will support your growing bumps very well, and it can also help in relieving backache. So as a pregnant woman, you have to be very careful. You have to make sure that whatever you feel that is not right, please go and see your doctor in time so that everything will be fine. You will get treated and your pregnancy can grow to term and you have your bouncing baby. As a midwife, when you are taking care of a client from antenatal clinic, maybe right from when she was 3 months old, pregnancy until she delivers, and they come for postnatal clinic and you see her and the baby doing fine, there's a kind of joy that we experience also, that yes, we did a very good job with God on our side. Everything is fine. Nobody wants to lose no midwife will be happy if your client loses her baby, or a client also lose her life, or something terrible happened to her. We don't pray for that. Me personally, I pray for my clients. If I have pregnant women around me, or either my clients, I pray for them that they should deliver peacefully and everything should go accordingly, that no bad news from any angle. So I always pray for them. So because pregnancy alone is a stressful journey for 9 months. That's why people will say, if you are pregnant until you deliver, you don't know anything. Until you deliver, you go into that labor room with your 2 legs and come back successfully without any problem. That means God is to be praised. Although the Bible says in everything we should give thanks, but every pregnant woman, even midwife, even doctor that are treating pregnant women, are also praying that everything should go normal. Then again, that is all about backache in pregnancy. It's not much discussion. Then what I want to say again is people that will say they don't want to do CS. CS in the olden days was different from now. Things are better now. So if you are going to the clinic, because sometimes during antenatal clinic, they would have known that, especially when you are around from 36 weeks to 40, there are some situations that will show your midwife or doctor that this one is going to go for elective CS. In fact, some they would have booked them for elective CS during that antenatal. If they see that there's CP, there's what we call CPD, cephaloprophic disproportion. That means the baby's head is bigger than the birth canal, that is the pelvis. The baby's head cannot go through. So then the position of the child also can determine whether you have CS. If the baby is transverse, the baby is breech. But in most cases, breech, if it's a well-fleshed breech and with good contraction, we can deliver. I've delivered so many breech babies when I was working, but to be on the safe side. Or the baby is transverse, or the baby is presenting the shoulder. There's no way a baby that is presenting a shoulder will be able to deliver normally. The normal presentation is cephalic, that is the head on the lower part of the abdomen. Is directly on the cervix. That's the best position that will make it easy for a woman to have spontaneous vaginal delivery. But you see, this CPD can cause it, especially some short women. Most of them, you see that they deliver through CS because of this CPD. It's very common. Cephalopelvic disproportion. So if they tell you in the hospital that you'll be going for CS, before people will say, I reject it, I reject it. Yes, we are Christians, we are Muslims, we don't want any bad thing to happen to us. I remember a lady told me that when she went to the hospital, they told her that maybe they would do CS for that. She ran away and she took away that she delivered normally. I just laugh because sometimes no need to argue with some people because they are so gullible. Even if you argue with them, they can never understand that. What has Ewedu got to do with your delivery? Shey Ewedu will enter inside the uterus to make it slippery that the baby will come out. So I don't really like arguments, and you just make people to be feeling offended. So I just laughed when she told me. But to be on the safe side, there's no big deal in CSO. It was before people say, hey, this day you see a CS patient, 2 days, 3 days, they are discharged her home to go and take care of her baby and to come back in 6 weeks' time. Your life is very important. And to you women out there, pregnant women or aspiring pregnant mom, or you are trying to conceive, God will answer your prayer. Please, your life matters also. Yes, you are carrying a baby, but you should also look where you are the cooler that the baby is inside of you. So the decision most time is from you. If doctor says you are going to have CS, your mother-in-law will now say, no, you are very lazy. You will deliver like the Hebrew women. Or your husband says, no, you will not sign. Please get your brother or your dad to sign for you. Because if you die, that man will not even stay up to 6 months. You will get another wife and you'll be in the grave lonely, and your child may survive to now be suffering because nobody can take care of your child the way you take care of your child, and nobody can love your child the way you love your child. No matter, even your siblings, they can never love your child like the way you love her. That special bond between a mom and a child is never replaceable. So please take very good care of yourself. Attend your antenatal regularly. Take your prenatal drugs regularly. If you have malaria, please report to the antenatal clinic. Get treated. Do all the lab investigation you are asked to do, and make sure everything is okay before delivery. If you have done your best and maybe there's a slight problem, don't bother yourself. Everything will be fine and you'll be okay. Please don't play with your life. You only have one life, and when it is gone, it is gone. That's the truth. You know, like me, when we are taking history during antenatal. We have some people that they have bad obstetrical history that by the time you listen to that their obstetrical history that is so bad, you don't have any reason than to go take them to the doctor that they will be booked for CS. You will see some people will be, maybe she has gotten pregnant in her life for like 8 times, but no child. It's only this pregnancy that is carrying. So that's a precious baby. In that situation, the woman will have to go for elective CS, because that's the only way we can make sure that this baby will survive and she will have a child of her own. A lot of women are going through hell. You know, some people will be delivering like that and they will not rest. They will not do family plan to even rest for some time. It may be, maybe you have a resource factor. Maybe you are resource negative and the baby you are carrying is resource positive. If you don't know all these things, you consider, you know, in the olden days, say, Abikulo Yolenu, Gbogbo, every time you'll be having children, they will be dying. It's not ordinary spiritual attack. Go and check your resource factor, because this could be the reason. And if it's the reason, there is a solution to it. I think during your 20th week of pregnancy, you can have Rugan injection twice before delivery. I can't really remember, but I know that Rugan injection will be given to prevent antibodies reaction between your resource negative and your resource positive baby. So most people, they don't know these things and they continue getting pregnant and they will be losing their children. Especially in Yoruba land, we believe in that abiku in the olden days so much. I was telling somebody a few days ago that, you know, this abiku that people used to say, it wasn't really abiku. It was because some medical laboratory investigation that ought to have been done was not done, because people, as at that time, people didn't know that there's anything called resource factors. But it is happening. Look at in case of habitual abortion. So habitual abortion means that the woman, every time she gets pregnant, she will always abort that child. Not intentionally. The pregnant, she will miscarry. Every time she will miscarry. Every time she will miscarry. It's not her intention to be losing that baby. But something is wrong. It may be cervical incompetency. But everybody knows now, because this is 2025. A lot of things, a lot of development, a lot of research has been done that you see some women, they will now do cervical encyclage for them. And what this means is that they will use the stitches to tie the mouth of the cervix, so that even if the cervix is opening, the baby will not come out. But they will tell you to be attending antenatal regularly, to come for your scanning, and also to make sure that you don't fall in labor before you come to the hospital. And in most situations, they may do CS for you. When you come to the hospital, they will loosen that suturing so that you can deliver. Because if you are contracting without coming to losing that thing, it may lead to rupture of the uterus. It may lead to, in fact, terrible tear of the cervix. And tear of the cervix during delivery, because the cervical host is highly vascularized, the patient could bleed to death. So all these things, most people don't know. They say, she has gotten up, since she married, she has gotten pregnant like 10 times, but no single child. Go and get yourself checked. Even if your husband is not showing interest, please take yourself to the hospital and get checked. It's your life. It's your life. Me, I advocate women to really love themselves. Me, people that knows me, they know that me, I'm obsessed with myself, because I believe I'm the most beautiful woman on earth, and I believe I deserve to be happy. My mental health is a top notch. It's 100%. So you should see yourself that way. Yes, marriage is good, but if you are being stressed, it does not care about your life, please take care of yourself. Because of your children. Because if anything happens to you, those children will suffer. So it's better for you to be alive, to take care of your children. So many people, they don't know this thing, that this habitual abortion, anytime she get pregnant, maybe before 3 months, and before you can do this cervical encyclage, the pregnancy must be around 16 weeks. That's about 4 months before they can do cervical encyclage. But the pregnancy will not even reach that time for some people, and it will be coming down. And as soon as the doctor does that cervical encyclage, you see that the pregnancy will grow to time. It's God that gives all these doctors knowledge to help women, to help people to live a good life. But you know, most people, I don't know what hospital has done for them. They don't just want to go. Some people will say it's money. And that's how some people will eventually end up not having a single child. A single child because of small things that they're supposed to have done. Okay, now we are talking of IVF. These days is very common. IVF, surrogacy. But you find that when you discuss with a Nigerian woman or African woman about IVF, some people, they still don't know what it means. One woman was telling me that it's not the will of God. I said, what is not the will of God? Is it not the sperm of your husband and your own egg that they will use? They will fertilize it outside and transfer it to your uterus, and you will carry the baby to term. What is not God's will there? That is why you see some women in this part of the world, they will live forever without having children. Even if that IVF will fail, if you have the money, please try and do it and see. You know, don't only your career. How do Yoruba used to say that proverb? If you don't try something, how will you know whether it will work? You may say, somebody own us, somebody did it 10 times. It's not your portion. You can do your own once and it will click. Look at that Olivia that on Facebook. It was her last embryo that they implanted, and the pregnancy is already growing because she lost her fallopian tubes to ectopic pregnancy. Because if you don't have tubes, it will be very difficult for you. It's not even possible for you to fertilize except miracle. I mean, believer, and I believe in miracle. But you know, we women, our fertile period is very short. Unlike men, a man in 90 years old can give somebody or can impregnate somebody, but you as a woman, as soon as you are 45, it even depends on you. I know a friend that just some few years after 40 she entered menopause. So please take very good care of yourself. Do things that will help you, you know, in your journey of motherhood. Don't listen to side talk. If it's IVF and your husband can afford it, you don't have to tell anybody. Go and see a good, go to a very good IVF clinic and get it done. And even this surrogacy that we are talking about, you know, everything that comes to Nigeria, the way people will bastardize it, you'll be shocked. I don't know why we are like that. You know, there's nothing wrong in surrogacy because it's still, the only difference now is that instead of that baby to be put inside of you, maybe your endometrial lining is not strong enough to carry a baby, you get a woman and they will put that embryo into her and she will help you carry your baby. It's your husband's sperm and it's your egg. When the baby is delivered, they will give it to you. Also, this lady on Facebook, Nancy Ume, Cora's elder sister, she did, and you can see the baby looking with striking resemblance with her husband, Brookwood. So I pray that God will give so many people understanding. Me, I don't believe in, because you are spiritual, then something that will help you. So far, it's not a sin. I'm in for it, and this is not a sin. So please, whatever will make you happy, do it and ignore whatever anybody will say. Me, I don't listen to what people will say. Anything that I'm convinced and I've prayed about it, I will always do it. So many ways that you can make yourself happy as a woman that is trying to conceive. Pray about it. Even your diets can also affect your getting pregnant in time. Please make sure you watch whatever you eat. Your weight, if doctor asks you to lose weight before IVF, you have to take some injection, you need to you know, drop some weight, please do that. Do exercise and make sure your mind is settled, because even stress as an anxiety will never allow you to get pregnant. So all these things are to be considered if you are trying to get pregnant, and make sure that you take, also we have what we call prenatal preconception multivitamins. Take folic acid to prepare your body for the baby that you desired so much. So I think, thank you. Oh no, madam. I don't know how to speak French. Thank you. So I don't know if you have questions, you can drop it for me. I appreciate you for listening, and please like and share. You will gain one or two things. So till I come again, thank you and have a beautiful day.